The surge in cancer cases among young people is alarming oncologists, doctors, and scientists. The risk of cancer diagnosis between ages 15 to 39 has risen 40% since 1975. Over these 50 years, young people's cancer risk has significantly increased. This mystery concerns the cancer community, now trying to understand the cause. Cancer rates are rising globally, but some countries stand out. US, Canada, Australia, UK, and parts of Europe lead due to the Western lifestyle. People there consume many ultra-processed foods, often cheap and convenient. These people drive cars, don't walk, take elevators instead of stairs, and sleep poorly. There are 14 types of cancer with increasing incidence among young people. First, breast cancer. I know two women under 30 who developed breast cancer. One has an aggressive form that spread to her liver, and she's been on chemo for 5 years. Besides breast cancer, there's colorectal cancer, endometrial, esophageal, bile duct, and gallbladder, head and neck, kidney, liver, bone marrow, pancreas, prostate, stomach, and thyroid cancers are also types of cancer whose incidence is increasing among young people. Many patients seem perfectly healthy before diagnosis. Athletes, people with good diets, and those who exercise regularly. A cancer diagnosis is shocking at any age, but it's even more jarring for young people because we don't expect the young to get cancer. When an older person is diagnosed with cancer, it's surprising and shocking, of course, but it's not as unexpected for a 60 or 70-year-old to have cancer compared to someone who's 25 or 30 years old having this disease. In the 15 to 39 age group, people are caught in a sandwich situation. On one side, they might need to care for aging parents, and on the other side, they may be starting their own family or saving up to buy a house, for example. At this point, a diagnosis can be very destabilizing. The cancer type rising among young people is colorectal cancer, affecting the bowel or rectum. To give you an idea, someone born in 1990, just 34 years ago, is 4 times more likely to get colorectal cancer than someone born in 1950. By 2030, colorectal cancer will surpass breast cancer as the leading cause of cancer death in young people. One problem with colorectal cancer is that it affects a stigmatized body part that many are ashamed to discuss. This often leads to diagnoses at later stages, which makes treatment more difficult and less effective. Another factor is that many young people are developing more aggressive tumors. As a result, diagnoses are often made only in the later stages of the disease. So, why are young people being diagnosed with cancer more frequently? There are several factors. So, why are younger people being diagnosed with cancer more often? The first factor is improved screening, which we call screening, that is the search by cancer. A common screening test is mammography, used to detect breast cancer. The health ministry advises women over 50 to get screened every 2 years, even without symptoms. Screening rates have increased. As a result, we're detecting more cases, but that's not the only factor, as cases aren't always caught early. Also, young people aren't in the age group where screening is recommended. Prostate cancer screening starts at 40 or 45. Colorectal cancer screening via colonoscopy begins at 45 or 50. So 30-year-olds won't routinely get screened for colorectal cancer. They'll only seek screening if they have symptoms. Diet is a key factor in the rise of colorectal and other cancers. Of the 14 cancer types I mentioned that are increasing, 8 involve the digestive tract. Let's see. Colorectal, rectum, digestive. Esophagus, digestive tract, bile ducts, gallbladder, liver, pancreas, stomach, all part of the digestive system. So diet directly affects the risk, either increasing or decreasing cancer risk. Why? Our diet has changed dramatically in recent decades. We're consuming too much processed meat, excess sodium, sugar, alcohol, and calories, while drinking less water and eating fewer fibers, all of which increase the risk of various conditions that in turn raise a person's chances of developing cancer. For instance, diabetics with insulin level issues also face higher cancer risks. Besides diet, sedentary lifestyle and sleep also affect cancer risk. So if you're sedentary, if you don't move much, if you don't burn enough calories, you won't have what's needed to fight inflammation in your body caused by a sedentary lifestyle and excess weight. This creates an environment of chronic low-grade inflammation, which does increase cancer risk. And sleep is crucial. So, who here sleeps 7 to 9 hours a day? Write in the chat or comments how many hours you sleep daily, as I know many swap day for night. I know many go to bed late and wake up early for work. And you, how many hours do you sleep per night? Your sleep quality directly impacts your overall health. It's during sleep that your body repairs and maintains its structures. So if you don't sleep well, your body isn't recovering properly. Besides inactivity and poor sleep, there are environmental factors, microplastics, toxins, pollution. We suspect all this influences cancer rates, but it's hard to measure the exact impact. Even pollution, which we'd expect to cause lung cancer, isn't increasing in young people. Another risk factor being considered is height. Humans are getting bigger and taller over time. This might matter because more cells mean more chances for cancerous mutations. Larger, heavier people have more cells that divide more often. More cell divisions could mean a higher cancer risk in theory. The type of birth is another factor being considered. Studies show C-section births may increase risks of certain cancers. And why childbirth? Because vaginal birth in theory, right? This theory, though unproven, suggests that vaginal birth covers the baby with microorganisms. These may strengthen their microbiome, enhancing beneficial bacteria in the child's body, making them friendly bacteria for that child. Folks, we've discussed the known risk factors and those being evaluated for their potential impact. But how can we reduce cancer risk as we've seen? We've seen an increase from 1990 to now, but we're unsure how to reverse this trend. Will cases keep increasing? Will cases decrease? We need to better understand the causes and contributing factors. That's exactly what lifestyle is about. If you don't have a healthy lifestyle, eating well, exercising, managing stress, sleeping well, and not overindulging in drinking or smoking, if you can't maintain beneficial social relationships, all of this will increase your risk of illness and cancer. In about 30 seconds, I'll tell you how to have a healthy lifestyle. But first, let's talk about treatment. Thanks to better screening, we're catching cancer earlier, improving prognosis and treatment effectiveness. Starting treatment early, along with improved therapeutic strategies, has made a significant difference. So, folks, while the risk of cancer is increasing, which is bad, there's a silver lining. The risk of dying from cancer is actually decreasing significantly. This is due to advancements in treatments and earlier diagnoses. Now, about the lifestyle I mentioned that protects you not just from cancer, but also from stroke, heart attack, diabetes, high blood pressure, high cholesterol, depression, anxiety, and insomnia. All these conditions are directly linked to your lifestyle, habits, and daily choices. If you want the best lifestyle to shield you from these diseases, one that might even help you reduce or eliminate medications for blood pressure, diabetes, cholesterol, sleep issues, anxiety, or depression, I teach you how in my book. Get the longevity code by clicking the first link in the description or pinned comment. Buy the digital version for just $29.90. If you're not satisfied, I'll refund you, no questions asked. Our friendship stays intact and I take all the risk. Here's what to do. Want the best lifestyle to prevent, treat, and reverse diseases? Click the first link in the description or pinned comment now to get your longevity code.